Hey guys, how you going? Welcome back. My name's Kris and today I am going to tell you one of the craziest stories I have in my arsenal from my last 10 years in the medical field. Quick disclaimer, of course, there will be details changed, including names, ages, locations, and that kind of thing. Though, to be honest, I actually don't remember the patient's name because it really didn't matter to the story, and everything else is really not important. The story stands out for itself. So, if you want to know how I got asked for a threesome by a magician, stay tuned. This is not clickbait. So let's set the setting. I was living in a rural town at this point doing an emergency department placement in my second year of medical school. So this is back in 2012. So 8 years ago. In our emergency placements, quite often medical students get to take a history and do a simple examination of patients before going up to a senior, whether that was a registrar or a consultant or a fellow, and walking through the case and figuring out the best management steps. So EDs can be very, very busy and can be full of jam-packed action, car crashes, burst appendixes, that kind of thing. But sometimes, especially in the more rural areas, not a lot happens. Occasionally you'll get an interesting case, but sometimes it's very much what you would see in primary care or in GP. So on this fine winter day back in 2012, I was in a rural town, and at the triage, so the nurse that sees you when you first come in, it popped up and said that there was two 18 to 21-year-olds, one male and one female, wanting to be seen together. I'm going to try and insert a couple of red flags up here so you know which part of this story is a red flag. God, I'm so self-explanatory today. So red flag number one, they wanted to be seen together. Not unusual, but it is unusual to have two people quite young who've never been to this hospital before, mind you, to want to be seen together. Did they get injured together? Were they in an accident? The triage nurse only said, want to be seen together, flu-like symptoms, but in commas. So that's bizarre. And so the triage nurse does their best to very much get an idea of what is happening and how quickly you need to be seen. Amputated leg needs to be seen really, really quickly. Snotty nose can usually wait until we deal with the sore bellies and the diarrhea and the kids and things like that. So being the energetic and overzealous second year medical student I took them into a room and sat down and did my normal spiel. Hi, I'm Kris, I'm a second year medical student. What brings you in today? The patient that spoke the most was the male, so he started by saying, "G'day, my name's Bob, and I'm a magician." Ding. Oh, okay. So I was really confused, but the story continues. I'm a magician, and 2 weeks ago I went down to Brisbane to enter this magician's competition. I didn't win, but anyway, after the show I got really pissed and I was on the side curb outside the venue and I saw this young Sheila crying, you know, and I'm thinking, huh? I'm really confused. And I looked to his partner who was sitting next to him and she's just like, I'm like, okay, clearly there's got to be a link here, so I kept listening. So yeah, this young Sheila's on the side, right? And she's sobbing, and being the nice guy I am, I decided to go over and have a chat to her. Turns out she's been kicked out by a bloke, you know, and she's got nowhere to go, so being the nice dude I am, I gave her a cigarette and I gave her a drink and we went back to my place. Okay, so 2 weeks ago, was out of town, met a girl, flu? Story continues. So anyway, she slept on the couch. Oh, no, actually, no, I'm a gentleman. I made her sleep on the bed. Looked to the girlfriend and she's like, okay. And so I came back up here and since then I haven't been right. And I'm like, okay, trying to pull together. Right, so you said to the triage nurse you've got some flu-like symptoms. Oh yeah, nah, we don't. Okay. Now I'm really confused. So what brings you here today? And he goes, so, it hurts when I piss. Right. How long has it been? Well, yeah, since I went to Brisbane, I just told you. Oh, okay, so it's been 2 weeks of painful urination, known as dysuria. Okay, any other symptoms? Yeah, got a discharge. Ooh, okay. Me, as a 19-year-old second year medical student, had no idea how to deal with this. So I was like, okay, tell me more. So we went through, and essentially, I'll save you the very bad Bogan accent. He's a 20-year-old with a 2-week history of painful urination and discharge after a trip outside of his normal community. He vehemently denied having sexual intercourse with anyone else, and his girlfriend's sitting there and seems to be very open. I did offer to talk to them separately, but they declined. And no other symptoms, so no fevers, rigor, belly pain, cough, cold, runny nose, rashes, anything. So I'm like, okay, fine. And I turned to her and I'm like, do you have any symptoms? She, in a very thick Australian accent, was like, yeah, nah, yeah. So for those who don't speak Australianese, yeah, nah, yeah means yes. Nah, yeah means yes. Yeah, nah means no. It's very confusing, even I have to think about it. So anyway, so they both have symptoms. She's only got a discharge, no pain, and there's been no pain during sex. So I then figure the only thing that I could think about was I need a urine sample from you both to test you for a UTI, or a urinary tract infection, and STI, a sexually transmitted infection. So I sent them off their way and I went back to the doctor's room where everyone was having a giggle. So the hospital that I worked in at the time had very thin walls. It was a very old house, an old Queenslander, and yeah, they could all hear and they went, yeah, you did pretty well actually for such a weird circumstance. So they sort of gave me the heads up, it sounds like an STI, we can't get a test back very quickly, so treat them both empirically or without proof of infection. Keep them safe basically. And the treatment for what they had suggested was a shot in the bottom of ceftriaxone for gonorrhea and a tablet of zithromycin for chlamydia. We were going to test the full panel, and I was also going to send them for bloods to make sure there was nothing else going on, with their consent of course. But that was the plan, unless the urine dipstick came back and was like, bing, 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 you have a urinary infection. That was the plan. So I get the urines, I dip them, definitely no urinary infection, so I tell them I'm going to treat them for STIs. How do you reckon I got that, doc? Well, and he goes, oh, she slept in the bed I slept in. Yeah, makes sense. I'm like, no, that's not how you get STIs, but okay. In the end, I was able to sort of say, is there any chance you would have had sexual contact outside your relationship? And then they both sort of went, oh yeah, we're in an open relationship. Fine. So I talked about the importance of contact tracing if it came back positive, blah, blah, blah. I'm not going to bore you with the medical stuff any more than I already have. So it comes time to treat them. So I asked who would like to go first, and the girl actually volunteered. So when we're giving an intramuscular injection, it's usually in the big muscle group. So something like ceftriaxone we quite often put into the buttock. So I asked her would she rather stand or lie down, and she said lie down. So she's lying there, her bottom exposed to me, my hand grasping it to get a good grip so I can inject. And before I could really get close, this pack of cards is splayed over her bare ass. I wish I was making this up. Pick a card. Pick a what? I looked at him and I was like, this is completely inappropriate. I'm trying to jab your girlfriend. He goes, oh, I thought you'd like to see a trick. Oh my god, no. So anyway, I finally inject her with the cards well on the other side of the room, and it's his turn, and he decides to bend over, of course making the most obscene noises the whole time, which just made me feel so uncomfortable. But this was not the best part of the story. The best part of the story comes once we've injected, they've had their tablet because we had them on hand in the ED at the time, and had their pathology forms to get their bloods done, and we're sitting there as I'm writing the discharge letter to their GP so their GP could be CC'd into everything. And he looks at me and goes, you're not from here, are you? I'm like, no, actually I'm not. And he goes, I reckon we're related. No sir, there is no way we're related. No, not by blood. Spiritually. Okay. Ding ding ding. Make me feel real uncomfortable here, dude. But the crux of it was he leaned in, all close, and said, you want to go back and, have a threesome? What? I just treated you both for gonorrhea and chlamydia, and you want me to go back for a threesome? Are you? I kicked them out. almost immediately after that, I was completely grossed out. I could hear the roaring laughter of my colleagues or my supervisors in the other room. They were really good about it. They actually asked if I was okay. They were more laughing at the absurdity of it all. But yeah, so that is the story of how I got asked to have a threesome with a guy, a magician that I just treated for chlamydia and gonorrhea. Don't hit on your doctors, guys, please. Like, no, there's no situation in which that is okay. But being treated for an STI and then asking for sex is just weird. So anyway, if you learn anything from this, please know it's not okay to hit on your doctors. We're people too, and we feel weirded out. And people lie when they go to triage desks. As Dr. Gregory Howe says, everyone lies, and it's important to realise that in medicine. If you thought this was interesting and you wanted to hear a few more of my stories I've collected over the last 10 years, let me know. This is definitely the one I pull out first when people ask for interesting experiences, but I definitely have more I can tell you. Until then, guys, stay safe, stay healthy, and let me know what you'd like in a future video. See ya!